I'm an internist. That means I'm a general internal medicine practitioner here at Yale New Haven Hospital. I'm a hospitalist, and since March, all I've been doing exclusively is taking care of COVID patients. So we started mid-March, and the work that I've been doing has been COVID care exclusively, nothing else. I've become now essentially the clinical expert here at Yale New Haven on the care of COVID patients, lecturing on the subject. This has become my area of expertise. Not really something that I had hoped to devote my career to, but here we are. So Chris asked me to come on because there are a few points that I wanted to help make just about how you can protect your staff and keep your business open, because we all love to play tennis. I mean, do you see my hat here? It's really cute. We all love to play tennis, so I want you to keep your business open, and I want you to be able to do so safely. All right, let's see if I can share screen. No, Chris, come on. You're still not letting me share screen. Seriously, Chris?
I don't know that I'm the one stopping you from doing that. And I'm trying to find a thing that says share screen. It says allow to multi-pin and all this other stuff, but it doesn't say anything about you sharing screens or not. So can you try to do it and see if it lets you?
Host has disabled participant screen sharing.
Really? What a jerk.
Seriously, Chris?
I know. I'm not a good host. We all know this.
You can make her a co-host, Chris.
Good. Thank you. Someone knows what they're doing.
Yeah, you can make her a co-host.
There you go. You are a host. There you go. You are in.
All right, let's try this. All right, here we go. Look at this. Microsoft PowerPoint. Here we go. I am going to share with you. All right, good. You guys can see my Chris, give me the thumbs up. Can you see it?
Yep,
good.
You're good.
All right. All right. So let me just get, okay. So I just want to go over some of the Connecticut state data where we are right now with COVID. I want to share with you our hospital projections of where we're going. We've got some pretty smart people who've been making projections. And then I want to talk about the risk to your pro staff, and then about just keeping your programs going and keeping the staffing adequate to keep your programs going. What happens when somebody gets exposed on your staff and what the guidelines are. And I really want you to be able to keep your clubs open. So I'll give you some guidance there as well. So this is the Connecticut daily COVID-19 positive rate. So in blue, we're starting in April, and we're going all the way to today. These are new cases detected every single day. And you can see those really great months we had where there were very few cases in Connecticut. So it was a great summer and fall, wasn't it? And then you can also see the cases rising. The black is the case rate. So that's the number of positive tests over the number of tests done. It's a little wacky back in April because we had no testing. So you really can't even look at that because we really weren't detecting all the cases that were out there. But since June, we've had really reliable, very abundant testing. So if we kind of look since June, yeah, the case rate's been really low. There are very few cases. And so this is real. We're at a 6% positivity. 6% of the tests are positive. It is rampant in our communities, and it continues to go up. So I just want to make that point first. And then a lot of people say, well, it's not so much the cases, it's really like who's getting sick, right? I mean, if we're just detecting a lot of asymptomatic people or just people who are really just have the sniffles, we don't really care, right? So let's look at who's getting sick. These are the number of patients who are actually hospitalized with COVID in the state of Connecticut. So we peaked at 1,972 patients on April 21st, and we're headed straight north. Yesterday we had, 848 patients admitted within the state, and today, unfortunately, we broke 200 just here at Yale New Haven in New Haven, like not the whole system, but at Yale New Haven Hospital, we just broke 200 patients today hospitalized for COVID. So this is not going well, hence my stress. All right. Now, this is interesting, and I just want to show this because it shows that not only is this not going well, but it's going rapidly in the wrong direction. So on October 11th, what was that? Like, I don't know, last week? It was not that long ago. October 11th, our very smart projecting people said, Okay, so here are the inpatient cases at Yale New Haven, peaking in April, declining all the way through till June, a nice summer. And this is to where we were on the 11th of November. This grayed out area is their projection of where we're going to be through January inpatient cases. So on 11/11, they were like, oh, look, we're going to kind of level out. And yeah, it's high, but it's going to level out. So we're all kind of feeling okay. On 11/18, what was that, 2 days ago? We got new projections. These are our new in-hospital case projections. I'm showing you this to emphasize this is no joke. Our new projections take us going straight north through till January with error bars that we could potentially exceed our April peak in January. So, but remember in April, we were on total lockdown. And so we didn't have to talk about should we be playing tennis with masks or not. It wasn't even a conversation because we were not playing tennis. In January, we're going to look a lot like April. And so I suspect by January, you'll look back on this conversation and say, oh my gosh, I can't even believe we were having this conversation. It was, obviously we need to wear masks, but let's have the conversation. So here's what happens in your club when your pro gets exposed. So here's an average clinic. Do you like my little diagram here? We got 4 people on the court. I don't play doubles, but this looks approximately like how people play doubles. And you've got your pro, and this person calls the club the next day and says, oh my gosh, you're not even gonna believe this. I started to feel sick and I got COVID tested. And you look back on your court sheets and you find out that yes, that pro was on the court with this person within 48 hours of their onset of symptoms. And so this is considered a close contact exposure. So what do? Your pro cannot come to work. Your pro needs to quarantine from all contacts, including household members, completely quarantine. If the pro develops symptoms, they should get COVID tested, obviously. If they don't develop symptoms, regardless of whether they have a negative test, if they do not develop symptoms, they require 14-day quarantine. Like, that's not negotiable. So you lose your pro for 2 weeks based on that on-court exposure. If your pro develops symptoms, and I mean that as in if your pro develops symptoms after an exposure when they're quarantining, or if they just develop symptoms because they've got the sniffles, whatever, they develop symptoms, obviously they cannot come to work. As soon as they have symptoms, they need to get COVID tested. They need to quarantine from all contacts, including their household members. If their test is positive, they need to be quarantined for 10 days from symptom onset. So you've lost your pro for 10 days if they develop symptoms and have a positive test. Here's the kicker though. Anyone they were in contact with for 48 hours prior to the onset of symptoms requires 14-day quarantine. So presumably they were at work those 48 hours before they developed symptoms, and you just lost all your staff members who were potentially in contact with that pro within 6 feet for more than 15 minutes. So any exposure at your club, either from a client, presumably, or from a staff member, risks a 14-day quarantine of your pro staff member. If the pro then tests positive, you're probably losing them for longer because of illness, and you will almost certainly lose additional staff members to quarantine because they will almost certainly have interacted in the 48 hours prior to their positive test. Now, I know everyone wants to know, why can't I just send them instead of quarantine? Why can't we just test? That's what the tests are for. Let's just do the test. They're negative. They can come back to work. We're done, right? So this is the hardest thing to explain and the hardest thing for everyone to really understand, because it just doesn't seem right that we should have a test and that we can't use it, but it's true. I'm exposed, or your pro, let's say, is exposed to the virus. There's an incubation period. The virus has to do its thing for up to 14 days before you develop symptoms. Then in the 48 hours prior to developing symptoms, that person is shedding virus like mad and continues to shed virus for 10 days after. All right. So let's say we know they were exposed to the virus, and because you got a call from the client who says, listen, I'm positive, I was on the court with so-and-so, and you send them for a test. Here's the problem. The probability that that test is positive is essentially zilch, zero. You will not get a positive test right after exposure. The probability the test is positive essentially peaks right at the time that the person is developing symptoms. So they're, even in the day prior to the onset of symptoms, they only have a 50% chance of having a positive test. So you're going to very likely have, I mean, it's going to be negative. It is almost certainly going to be negative, which is why we say you got to quarantine, because that negative test does not help you. So that's the hardest thing to kind of get that message out. But this is easy. This is an easy problem to solve. Wearing masks, both people wearing masks plus 6 foot distance reduces COVID transmission to essentially zero. Your pro is no longer a close contact when you get the phone call that so-and-so on your court tested positive. You say, that's fine. Everyone was wearing masks. Carry on. Now, if a 6 foot distance cannot always be attained, for various reasons, I am recommending that your pros use the KN95 masks that are available on Amazon, because then you're absolutely certain that your pro is not going to be lost to quarantine. And then potentially losing other staff to quarantine, you are certain you had your KN95 on, that's PPE, you're done. I know everyone's worried about people saying, I can't play tennis with a mask on, and I get it. It's not intuitive, but this has been studied. There's no carbon dioxide retention. Carbon dioxide is a tiny little molecule. It diffuses right through the cloth of the mask. Through the mask. You can breathe. It turns out there's no impairment in oxygenation. I played a match last weekend. We all played with masks. It was okay. So these are the masks that we're wearing in the hospital, just to let you know that, maybe there's something that we know. These are the various masks that we're wearing. So please let me answer all your questions. This is what I live and breathe. This is what I do every day.
Thanks, Jensa. If you want to unshare, and then we could do.
Okay, unshare.
Ready?
All right, let me figure out how to unshare. All right. Stop share. Got it. Done.
Does anybody have any questions? There's no bad questions.
Come on, you've got questions.
There's questions.
I have a question. So the masks are breathing. Is there a possibility that it goes through the skin?
Wait, I lost you there for a second.
Oh, is there a possibility that it goes through your skin as well?
No. Okay. So one of the things that people ask is about contact, and we have, at this point, the medical community does not think that contact is a significant means of spread. The literature shows that it's essentially droplet and aerosol, so it's breathing. It's all about breathing. And no, there's nothing going through your sweat.
What about gaiters? We have a lot of pros that are saying that they're okay with gaiters, and I know there's some discrepancy about the effectiveness. They just write that out.
Yeah, you're absolutely right. There is a hierarchy in masks, with the obviously N95s being the best, and then the surgical paper masks after that, then the cloth masks, then the gaiters, then the handkerchiefs or whatever people use after that. It's a hierarchy, but essentially the CDC says that if you're within 6 feet for greater than 15 minutes with anything less than PPE, you're considered a close contact. So gaiters, it's really not going to protect your pro if they're within 6 feet. If they're not within 6 feet and the other person is not within 6 feet ever at all, then I mean, you can, but I would think if you wanted to protect your pro, you would put them in a N95.
Yeah, I think I'll order them.
PPE is only K9, the N95. That's it.
So, so the N95s that we're wearing at work, you can't buy on Amazon. But the KN95s are the ones that are available on Amazon. Yeah,
These.
and yeah, those are available, and they are adequate.
Is a surgical mask considered PPE, like the paper?
No,
Okay.
the surgical masks are considered better than cloth, but not adequate if you're within 6 feet.
Okay.
Anyone else? Any questions? No questions?
Yeah, 6 plus 6
I have one.
feet.
I
Okay.
have one. Can you hear
Go
me?
ahead, Karen.
Yeah.
Oh, okay. Okay. So my question is related to, let's say you do have a singles court and you do allow them to play without masks. They're greater than, the required distance apart while they're playing, but then, they put their masks on, they leave the court, somebody else enters the court.
Yeah.
Does that,
Yeah.
let's say they have it, is it stay in the air?
Yeah.
I mean, what happens to the next people?
Yeah, no, it's a great question. That is a great question. So droplets remain suspended in the air. The duration of time that a droplet remains suspended in the air varies depending on your ventilation. So that's why outside is better than inside, because outside there's always some kind of air circulation and the droplets aren't suspended for as long. But absolutely, if you walk onto a singles court right after onto any court right after someone without a mask and you didn't have a mask on, you are at risk. No question about it. And that's also part of the reason why doubles without masks is so dangerous, because even though you could potentially always keep your 6 foot distance, you're continually running into the other person's space. They have just exhaled those droplets. Those droplets are suspended. You're inhaling them. That's it.
Jensa, it's Sarah.
Hi, Sarah.
I just wanted to know if you could clarify, and hello everybody else. I'm sorry, I have this big screen but no camera, so I can't see you all, or I can see you but you can't see me. You have clarified for me, and I think it would be helpful to clarify for others listening, that 15 minutes close contact is over what period of time? Because if you say to me, hey, you're playing doubles 15 minutes within 6 feet, I'll say, oh, but I'm just quick 30 seconds talking to my partner and we walk away, and then another minute talking about strategy and another minute learning the next drill or whatever. So can you talk a little bit about that, please?
Yeah. So the CDC did a really interesting study that showed that it is clearly a cumulative 15 minutes within 24 hours, and that can be 30 seconds plus 30 seconds plus 2 minutes. And so over the course of a 2-hour match or an hour and a half clinic, if you're intermittently within 6 feet, you are clearly at risk. And as I said, those droplets remain suspended. So even if you're not within 6 feet, but you move into their space and they move into someone else's space, you are at risk. Sarah, does that answer your question?
Yeah.
She got distracted.
I didn't get distracted. I muted so you wouldn't hear me.
Okay.
Yes, that did answer. Thank you.
Jen, so I have a quick question. As you were talking about keeping the staff safe and everything else, if you had that same clinic where you had, the pro and then the 4 people, and then the one woman on the court said, oh, I think I didn't have this, and no one was wearing masks, what happens to all the other people on the clinic?
Yeah. So they're all close contacts. Every single one of them is quarantined for 14 days. You would not be popular. That is a very quick way to not make friends. Everyone is quarantined.
Okay, thank you. We have a question in the chat, Jensa, from Len Samar. Does CDC still say that exercising with a mask is dangerous?
So the CDC has actually never said that exercising with a mask is dangerous. What they do say is if you are uncomfortable and feel that you cannot breathe, then you must do something differently. But they don't say it's okay to exercise without the mask. They just say change your activity, perhaps exercise alone, so you can not wear a mask, but they don't say it's okay to not wear a mask when exercising. Does that make sense?
Got it.
Okay.
Great. Anyone else have anything for Jensa?
Chris, are you recording this? This is Andre.
I am recording this.
I forgot to record it. Can you get it to me?
Yep, I got you. Okay. Any reason why people shouldn't be touching the same tennis balls during clinics, matches, etc.?
Yeah, great question. And of course, the answer is we have no idea technically. Nobody has studied it, so I can't tell you about the one study that showed this or that, but we really do not think that contact is a significant means of transmission of COVID at this point. So I would certainly say that in my own practice, I am super cautious, but I am now touching the tennis balls.
Thanks. Anyone else? Bill Donahue.
Yeah, I got a question regarding junior players. If you have a player in your program that has a brother or sister that is self-isolating because of a contact, how do you feel about the brother or sister coming into the program?
So that's a great question, and that comes up often. So here's the deal. Anyone who is a close contact, so that's usually a household member of someone with COVID, absolutely needs to isolate. If you are a close contact of a close contact, you do not need to isolate. So let's say the kid gets a call from the Department of Health that he was exposed at school and that he needs to quarantine. He goes home and he quarantines that kid who was exposed at school. Now his siblings do not need to quarantine because they were not exposed at school. And the siblings can all show up for tennis and lacrosse and school and everything else. Make sense?
What if the sibling shows up with the other sibling in the back seat of the car?
No.
Dropped off for tennis.
Are people crazy?
Yeah, I think so.
Yeah. So obviously, if you see that happening and then clearly they are not quarantined, and that's just a no-go. That's an absolute no. They are not following the proper quarantine guidelines.
It is hard to police it, of course, when we hear someone who says that child is supposed to be quarantined right now because and go and ask them.
Yeah.
We say, hey, should you be quarantined right now? But it's really hard to police.
Yeah. So you absolutely can't police it, which is why if you just have a standard, everyone's wearing masks, then you kind of take the policing out of it.
Yeah.
And your primary job is to protect your pros. I mean, first and foremost, of course you want to protect your clients, but protect your pros with KN95s.
That's the best I've heard.
Yeah.
Okay. Anyone else?
Yeah, Jensa, Peter Abernofsky. I have a question. Is the temperature test significant?
Oh, no. So absolutely not, because the time at which you develop a fever is the onset of symptoms. So you've been shedding already for 2 days by the time you develop that fever. So this is something that, we check people's temperatures if they walk into the hospital for, if there's any reason to come into the hospital and they're not a staff member. But we do that for optics. I mean, it's all about, we do a nice little screening questionnaire, we check your temperature, but truly, if you have a fever, it's too late. You've been shedding for 2 days. Yes, we don't want you in our facility, but we didn't want you in our facility 2 days ago either.
Is it still, though, Jensa, not a bad thing to do in case people who, aren't here for the 2 days then show up with the fever?
Sure. I think what it does is it screens out some small portion of people who did not realize they were symptomatic. So you are going to screen some people off, but it is by no means should be relied upon as a screening tool. Does that make sense? That you're going to miss a lot of people who are shedding virus.
Yeah.
But you might catch a few.
We have the thermometers on the wall, and we put them in at expense and whatever. And I'd already been talking to Jensa, but I do think it gives people a sense of comfort, and it really gets back to the optics of it. But that is not the tell-all. It's certainly not going to catch everything, but it makes people feel a little bit reassured. I think the masks are the way to go.
Great. Any other questions? Anybody else?
Extremely helpful. Thank you so much.
Oh, good. And, you know, Chris will put you in touch with me if you have any questions that are specific to your club. I mean, this is somehow I've had to become an expert in ventilation and all sorts of other things as this has come, you know, as this has evolved.
Appreciate it, Jensa.
Okay.
All right, Jensa, go save some lives. Thank you very much.
All right, I will. Thanks.
Thank you, Jen.
Thank you.